Hey ladies, welcome to the Forgotten Trimester, a channel dedicated to the education of women on all things postpartum. I'm Dr. Megan Gray. I am a board certified OBGYN and mom of two brand new littles. On this episode, I want to talk about swelling after delivery. Who does not have swelling during pregnancy? Oh, no, I did. I had a ton of swelling. I work on my feet all night long, delivering babies, doing surgeries. You should have seen my ankles after a night of work. They were huge. So they're just finally, I can just finally see them again. They're looking pretty good. But swelling during pregnancy and after delivery, completely normal. We used to associate swelling primarily with something called preeclampsia, which is high blood pressures in pregnancy. It is not used as a diagnosis for preeclampsia anymore. However, we do note that women who are preeclamptic will have an increase in swelling, and usually they'll notice swelling that occurs rapidly. And they'll notice it not just in their lower extremities, like their lower legs, they'll notice it in their face, like their nose gets swollen, their hands get swollen. It's kind of all over. They're just puffy. So I'm talking more about just swelling in the lower extremities, so your legs and the vaginal area, particularly after delivery. So most women think, oh, I just had a baby, all my swelling is going to go away. Yay! But sorry to tell you, not going to happen. In fact, most of the time the swelling gets worse in the first 48 to 72 hours after delivery. You may notice that you are now the Stay Puft Marshmallow Woman after delivery, especially in your lower legs and even in the vaginal area. Eesh, it hurts, it's uncomfortable, but it's normal. Sorry. So, what can you do about it? Make sure that when you are sitting down, try to avoid sitting in chairs where your feet are dangling down. That allows gravity to pull all that fluid down into your lower extremities. It just takes a longer time for you to process that fluid and get it back up, working towards your heart and processed through your kidneys. So if you're going to sit down for long periods of time, try to recline so that your feet are elevated close to the level of your heart to allow that blood flow back to your heart more easily. Number 2, drink lots of water. I know it sounds counterintuitive, but the more water you drink, the faster your body will process that fluid that's underneath your skin. Number 3, move around. Don't sit for hours on end. That fluid will just collect in your lower extremities. Get up and move. The more you move, the more those muscles squeeze those vessels and pump that blood back and fluid back up towards the heart so it can be processed. So get up and move throughout the day. So why the swelling after delivery, right? Like, okay, I delivered, don't I get at least one nice present in my body after delivery? I just had a baby. I should at least not be swollen and be cute, but it's normal. And so why does that happen? Well, our blood volume is increased by about 50% during pregnancy. So the amount of fluid in your bloodstream increases by about 50%. After we remove the placenta, all that blood flow that was going through the uterus, through the placenta to the baby has to go somewhere. All that extra fluid, it ends up kind of leaking out of your blood vessels underneath your skin. Eventually, your body will reabsorb or pull that fluid back into your blood vessels, pump that fluid back up to your heart, through your kidneys, and you'll actually end up urinating it out. So you may notice the first 2 weeks or so that you're urinating a ton, which is good. That means that your kidneys are doing its job and you're getting rid of that fluid. So expect to have an increase in swelling in the first 48 to 72 hours after delivery. Know that that swelling will improve over time. However, it may take up to 2 weeks for it to completely resolve. So be patient with yourself. Some things to look out for with swelling that may indicate something else is going on that needs to be evaluated. 1, if you notice you're having high blood pressure. So if your blood pressure, the top number is 140 or greater, or the bottom number's 90 or greater, not normal, needs to be evaluated. Swelling and associated elevated blood pressures, not normal, needs to be looked at. So if you're noticing that, notify your physician or your midwife. They need to evaluate. Number 2, if you're noticing that one leg is more swollen than the other, significantly more swollen, you're going to notice potentially that the right leg might be a little more swollen than the left. That's okay. But if there's a huge difference, I mean, it's visibly noticeable, not normal, needs to be evaluated. Okay. So if you're noticing that, let your physician know so they can look into it further. Number 3, if you're having pain in your legs, especially in the back of your legs, like the back of your calf or the back of your knee, and having that swelling, that might indicate something more serious is going on. It should be evaluated. Don't sit and wait for that pain to go away. Let your physician or your midwife know. They may want to do some ultrasounds of the blood vessels because that could be an indication of a blood clot in the lower leg. So if you're noticing pain in the calf or behind the knee, in addition to the swelling, you need to be evaluated. Number 4, if you are noticing redness of the leg, overlying where the swelling is, that should be evaluated. That might indicate something more serious is going on. So swelling in addition to some redness over that area of the skin should be evaluated. So just let your physician or midwife know so that they can look further into it. So swelling of the vaginal area is also very normal, especially if you had a vaginal birth and you pushed, or if you labored before a C-section. Very, very normal. That swelling will go down just like the swelling in your legs will go down. It may take a couple weeks for it to completely resolve. Same things apply. Drink lots of water. Try not to sit straight up and down on your vaginal tissue for long periods of time because gravity pulls that fluid down. And in addition, ouch, you're sitting on it, that hurts. So sit back, reclined, or lay on your side so blood can flow back away from the tissue and up towards your heart. In addition, ice packs are great for vaginal area swelling. That will help with inflammation and discomfort and also decrease a little bit of the swelling. So try some ice packs. You can do that 10 to 15 minutes at a time, a couple times a day. Just don't put the ice directly against the skin. Make sure you wrap the ice in an old t-shirt, or you can take a diaper and cut off the top of it and stuff ice in it and then place it directly against the vaginal tissue. Some women will even have an increase in swelling in their hands, upper extremities after delivery. And because of the way the nerves run in the wrist, they may notice some numbness and tingling in their hands after delivery. That's normal. As the swelling improves, just like in the lower legs, that numbness and tingling should resolve completely. You can try to put some wrist braces, especially throughout the day and at night, so your wrists aren't constantly doing this. They're kind of stabilized, so it'll take off the pressure off the nerves that run in the wrist to help with that discomfort. But be sure that majority of the time, overwhelming majority of the time, that resolves as the swelling completely resolves. If it doesn't, and you're still having numbness and tingling and the swelling is completely gone, let your doctor know. They need to further evaluate that. So that does it for swelling after birth. I hope that this gave you some insight on what is normal, what's abnormal, what to expect, when to call the physician. And I hope this makes the transition into motherhood a little bit easier for you. I thank you so much for your time today, and I look forward to seeing you here again real soon. Bye-bye.